I'm Dr. Sugar, your internet doctor, here to continue our discussion on understanding bronchitis. I will go into a lot more detail on the treatment as well as some ideas for prevention of bronchitis. So if you're ready, let's get started with a dose of medical inspiration. For acute bronchitis caused by a virus, you do not need antibiotics. Antibiotics will have no effect on viruses. The infection will generally clear on its own within 1 week. The steps that you can take for supportive care and the steps that you can take to provide some relief of your symptoms are: consider taking like ibuprofen or acetaminophen, Tylenol, Advil, ibuprofen, Motrin, those type of over-the-counter non-steroidal anti-inflammatories if you have a fever. Now remember, do not give aspirin to children. Secondly, get extra rest. Stay home, get some extra sleep. This is going to build up your body's immune system, so just get some extra rest. Drink lots and lots of fluids, and by fluids I generally mean clear liquids or juices that have vitamin C in it. Again, I really think vitamin C helps. Even though the studies don't always support my belief of this, I think vitamin C helps, so whatever form you like to do that in. And also use a humidifier or a vaporizer, or you could even go into a steamy bathroom for about 20 minutes just to kind of clear everything out. Now, don't smoke or let anyone smoke near you, especially when you're sick. And if you want to prevent that chronic bronchitis down the road, it's a great time to quit smoking now. If your symptoms do not improve, your doctor may prescribe an inhaler to open your airways. If your doctor thinks that you have a secondary bacterial infection in addition to the virus that caused the bronchitis or the chest cold, occasionally antibiotics will be prescribed for that secondary bacterial infection. For chronic bronchitis, the most important step you can take that I just mentioned is to quit smoking, because if caught early enough, you can reverse some of the damage to your lungs. Other important steps that you can take are to limit your exposure to pollutants and other lung irritants, get a flu vaccine every year, and get that pneumonia, the pneumococcal vaccine, as directed by your doctor. Attend a respiratory training program that includes physical activity and breathing exercises. Your doctor can recommend a medically appropriate and a well-supervised program. If it's early on in your disease process, you can likely exercise on your own, so talk to your doctor about safety levels. And if you have low oxygen, home oxygen may be prescribed for you to use when you sleep or perhaps all the time. Your doctor will usually prescribe inhaled medicines for chronic bronchitis. These drugs, which include bronchodilators like albuterol and ipratropium, they open your constricted airways and they aid in the clearance of mucus. In addition, steroids, either inhaled or taken by mouth, are often necessary as well. If you have an active infection, your doctor will put you on an antibiotic and sometimes recommend regular antibiotics to prevent infection, although this is rarely done actually. For acute bronchitis, symptoms usually resolve within 7 to 10 days if you do not have an underlying lung disorder. However, be aware that a dry, hacking cough can linger for a number of months. The chance for recovery is poor for people with advanced chronic bronchitis. Early recognition and treatment combined with smoking cessation significantly improve the chance of a good outcome for chronic bronchitis. I'm Dr. Sugar. To prevent bronchitis, wash your hands and your children's hands frequently to avoid spreading virus and other infections. Get your annual flu vaccine and your pneumonia vaccine as directed by your doctor. Minimize exposure to air pollutants. And quit smoking now, because you're not only making yourself sick, but you're also risking your loved one's lives and those around you. Hoping that you will choose today as a great day to stop smoking, and this time for good. You know you want to. Today's a great day. Thanks for checking in, and if you haven't already done so, be sure to watch all of the medical inspiration videos on understanding bronchitis. Thank you for your interest in total wellness, and when you have a medical question, be sure to check the video content library for many more medical topics. I'll join you soon for your next dose of medical inspiration.
Dr. Sugar can entertain and educate.
you.